Before we dive into remote patient monitoring, let's get to know you two a little bit better. Greg Eoyang, right?
Eoyang. The E is just
Eoyang. Eoyang. Okay. Greg Eoyang is the CTO of everbeat, which is a remote patient monitoring platform we're going to dive into deeper today. And Greg, I know you went to Carnegie Mellon and you've been involved in developing healthcare mobile solutions since 2012, but give us a little bit of a glimpse of your background and how did you kind of go in this direction with your career?
Well, I didn't intend to. I've been doing technical solutions since I graduated from college. I'm not going to admit when that was. And worked for a bunch of different federal agencies, but always tried to stay a little ahead of the curve. So I started looking at mobile apps in 2011, 2012, and realized most people were doing like games and stuff like that on their phones, and thought, well, what if we used it for something kind of serious? And then unfortunately, my late wife was diagnosed with ovarian cancer in 2012. So I got thrown into the deep end of the healthcare pool. And I realized it was a mess, especially with the IT side. I'm not saying the professionals who provide healthcare are a mess, but the whole infrastructure for technology is pretty much messy. So I kind of got sucked in and realized that there was a lot that could be done in that area.
Great, excellent. And for those of you who remember back in March when we first started doing these digital discussions, how my path first crossed with Greg, actually Christina, who's on the screen, introduced us, but she introduced us because Greg had acquired a lot of PPE, and instead of going out there and selling it on the open market, he wanted to make sure that some of these smaller senior living providers that it was difficult for them to acquire PPE received it. And so you may have remembered some of the emails that we sent out in the beginning. Greg was very generous in actually providing this PPE free of charge. And then he just sort of said, hey, look, I'm going to send this to you. And if you can send me a donation, I'll go and buy more. So Greg, thank you for your service. And I believe you have an inventory of PPE that you'd like to get out there to people that need it. Is that correct?
Yeah, absolutely. I mean, so I have contacts because we manufacture our devices in China, and they started asking me in like February and March, I'm like, do you need some masks? I'm like, I don't need it. Well, maybe I do need some masks. So yes, I do have plenty of masks, and I would like them to get out there so people can use them.
Great. So excellent. Well, I'll make sure to share your contact info with everybody. So and we're gonna jump back to Greg and the demo and learn more about his product and remote patient monitoring. But before we do that, let's get to meet Christine Gardelli a little bit better. Christine, you're the founder of Medicine at Home, which is a practice in Montgomery County, Maryland. Tell us a little bit about your background and what your organization does. Oh, unmute yourself. There you go.
Thank you. Sorry about that. Okay, I've been busy working and seeing patients, so my tech skills have waned over the last couple months. So I am a physician assistant. We don't call ourselves that anymore. I'm a PA. I own a small house calls practice here in Montgomery County, Maryland. I provide direct primary care and full wraparound service to patients who are too frail to go and see their doctors anymore. And I have a nurse practitioner that works with me, and together we see patients in Montgomery County and PG County, Maryland. We do palliative care, tertiary care, basically all the care that a patient would need or a loved one would need at home. Our job and mission is to keep you at home, safe in place, to the very end if need be.
Great. All right. Well, let's jump in to the topic at hand. And Greg, do you, and just so you guys understand the relationship between Greg and Christine, Christine actually has used this platform personally and in your practice. Are you correct?
Correct, correct.
Okay.
Yeah.
So let's jump in to learning more about remote patient monitoring. And Greg, I loaded up a couple of poll questions here. Do you want me to throw those up on the screen?
That'd be great. Yeah, so guys, we'd like this to be, Christine and I were talking, we'd like this to be as interactive as possible. We have lots of things to say, and if you don't ask us questions, we're gonna say whatever we feel like. So we would rather that you direct our comments so that we can answer your questions or go in directions that are more fun and interesting for you. So let me start off by just talking about remote patient monitoring, what it is, what it could be, and why it's important. Remote patient monitoring at its basic core is using devices like a blood pressure cuff. Let's see, there, you can see it fading in and out, or a pulse oximeter, or this is our everbeat watch. So they're kind of fun devices, or well, maybe the blood pressure cuff's not so much fun, but you use them to collect data about a patient. Obviously, it's the technical side. Christine, you can like tell me how you guys see it, because it's probably not, you don't view it as data. And it allows you then to have a better insight on what's going on with your patients. Now, if you take a step back and think about healthcare the way from a non-healthcare professional, one of the things that we realize is that we don't know much about how people's health really is. You know, you go to your doctor or your PA, and the PA says, "How are you doing? You know, how do you feel?" And they're gonna say whatever's on their mind. It may or may not be true. It may or may not be complete. Who knows? And then, so you have to somehow provide care to them based on a little bit of a skewed information. So not that these devices can provide you all the information, but at least well, let's put it this way. You have more data based on the health and performance of your automobile than you do with your body, right? You can tell that if it's low on oil, if it's low on gas, if your battery's failing, all these things, but you don't really know anything like that about your body. And if you, for example, don't treat your car well and you forget to change the oil and your engine dies, you get a new car. But you can't really do that with your body. So from kind of a mental picture of like remote patient monitoring, we feel is more a matter of how do you treat yourself? It's not as much about, don't take offense to this for all you healthcare professionals, but eventually it's not going to be as much about the interaction with the doctor, but the interaction with yourself, right? So what we found is that people actually do a lot of things because of the Prius effect, right? They look at their gas mileage and then they want to do things to make their gas mileage go up. So they look at their health and they want to do things to make it better. And so that's kind of the promise of remote patient monitoring. And what's really changed in the last 3 years, which you guys may or may not be aware of, is that CMS, the Center for Medicare and Medicaid Services, has really started to focus on preventative healthcare versus reactive healthcare. And so they've created CPTs where you can get reimbursed, we think pretty reasonably now. So for a month, each person can get, for each patient under remote patient monitoring, you can get reimbursed up to about $122 per patient, which may not sound like a lot, but Christine, maybe you can weigh in. Like if you have, how many patients do you have that are, how many?
About between 80 and 90.
Right. So if you do the math, 80 times, 122. Now, I'm a vendor, to be fair, and we would charge you something for our services, but what someone like Christine might get out of it may be $5,000 or $6,000 netting every month. So I'm not saying it's free money. I'm saying you earn that. You definitely earn every penny, but at least it's a fair amount of money for what you're earning. So that's kind of where remote patient monitor is going. I think we're just in the beginning now. It's evolved actually even since COVID. There are different rules that CMS has released saying that the devices don't have to be FDA cleared, and they changed the number of measurements you need. So it's a new field, and everybody's learning. But what I want to kind of talk about is a little bit of what makes it work, and then you guys can ask, questions to see whether it would work for you. All right. So the first thing that I would say is let's do a quick demo so that you can kind of see what a system like this looks like. Now, I will tell you that I'm going to demo our system. I'm not trying to sell it to you, but if you wanted to buy it, that's fine. There are different systems and they're designed differently. Ours is based around a mobile app. So I'm going to show you the mobile app. If I can remember how to do this. Okay, so this is my iPhone 12, and this is the Everbeat app. So you see it can track steps. So this was, I haven't done a lot of steps today, not so good. Also, if you think about steps versus steps and sleep, so that was my sleep schedule, they're not really health metrics, but they have a lot to do with your health, right? So if I can tell how much someone's been sleeping and how many steps they've been doing, then I can deduce certain things about how healthy they are, right? It's also very important that we realize there's no stigmas around wearing something that looks like this, right? But something, like a Holter monitor or something like that, nobody wants to wear those things. It tells you very horrible things about you're sick and you've got a medical condition and you're a patient, and nobody wants to feel like that. So we're trying to make it just normalize the fact that you're taking care of yourself, and it should be something that you're proud of. So there are different things that I've recorded here, an ECG, so I can show you that real quick. Here's my, I don't know if you can see this because I can't see the video right now. Can you see it, Christine?
Yes, it's perfect.
Okay, so I'm going to touch my finger onto this electrode. There's 2 electrodes underneath, and then hopefully we'll get a good ECG here. Let's see. No, that's pretty noisy. Hang on. One of the things that happens in the winter is that people get dry skin. So if you kind of moisten things, which is my affectionate term for licking your finger, sometimes it gets better. So let's try that again. All right, that looks like a real heartbeat, right? Like, not like I'm a dying chimpanzee or something like that. Okay, so our little algorithm has looked at this and it says, look, that looks pretty regular. I can do a blood pressure, but I'll save you the effort because it takes like 3 minutes or something like that. So that's not very much fun. I could do a pulse ox while we're talking for those of you who have potential COVID patients. So I've got this little guy sitting on my finger, and as soon as it comes up, it should tell me, let's see, I'm 98% saturated with 72 beats per minute. So I'll save it. And that's basically all it takes. However, that's what you guys, I'm sorry, that's what the patient is going to see. Now I'm going to show you what you're going to see.
Hey, Greg, while you're doing that,
Yep.
just out of curiosity, Louis Tenenbaum asks, how long between when you conceived of this product and it first being commercially available? Like what was the product life cycle there?
Do I have to admit that, like honestly, or can I? No. So as a startup company, what happened is we had one product that actually was supposed to be a conglomeration of all medical records together. So it would take things from Inova and Johns Hopkins and you know, whatever institution, and glom them all together and then show them on a longitudinal timeline. So it would show you that your blood pressure here was this in this institution, and over here was this. But I mean, data is data. It doesn't matter. So we did that for a couple of years, and then actually we went to chronic care management, where the reimbursements are like $43. So that didn't really, per month, that didn't really work. And then we finally found a number of cardiologists who suggested we do something that was a lot more urgent, and we got the watch. And so each one of those was about a 2-year life cycle.
Oh, wow.
And what we're working on now is getting FDA approval, which we kind of sort of hope will happen any day. But it's not quick, unfortunately. And what we've done as a startup is we've pivoted a number of times, and it's been about 2 years per pivot.
Okay. And then Vicky Stern asks, have you done user experience research with people in their 80s? And I'm assuming, Christine, you can share with us some of the experience that your clients had, but I guess if you could address Vicky's question about user experience for older adults.
Yeah, let me just walk through the dashboard, and then I'll get right to that. I think it's an excellent question, and it's a huge concern because in a way you're dealing with the wrong segment. I had my daughter, who was, I don't know, 19 at the time, set up an account to test something, and I was telling her, like, you have to click on this, you have to download this, you have to do, and she was done before I could tell her. Like, she was done in 60 seconds. But that's not the way the older generation is at all. So let me just walk through this really quick, and then we'll get to that. So here's the dashboard that you would see. This is my account, so you can see I took a blood pressure earlier. I just typed this in, so don't worry, my systolic is not that high, and my diastolic is not that low. But this is my weight, so I'm prepping for a big turkey day, you know. And then here's the ECG I just took, right? Super clean. And if I want to analyze it, actually, I can find one that's more interesting here. This one at 8:25 about a week ago, it's red, and that's because it says the abnormalities. We have a back-end process that runs some analysis on the waveforms. And so the reason why this one is abnormal is it's tachycardic. It's fast. And that's because I did this when I'm exercising in the morning to stress out our watch to make sure it's going to work. So anyway, it's a quick review, and you can see the information that's on here for remote patient monitoring tracking. You have to review for 20 minutes the patient's record every month. That's something that companies such as ours can provide for you, so you don't even have to do that. And then you might select a note, and then down here you'll see this is all the time that's been allocated for reviewing this patient. So that's the patient list, and then you can see a list of patients. And then you can click on anyone who might be interesting. Oh, so this is my CEO's brother, who has chronic AFib, which, if you guys know anything about AFib, you're going to look at this and go, yep, this guy's got AFib, sure enough. So it should be really easy. And you can see he's not showing steps. He's just showing ECGs. He's not showing blood pressure. So it can be based on what the patient needs, right? So I'll leave this up for right now. Let me go to the question about in their 80s. And that actually goes to the success factor. So jumping ahead, the most important thing for a successful RPM program is that you pick appropriate patients. In other words, ones that will benefit and that actually will be able to use your system. What we found is usually there's about a third rule. A third of the people will use it and will be absolute animals and will be on it every day, will not need to be reminded, and they're just awesome. A third of the people will use the system for a while and kind of need to be nagged, like, hey, I'm seeing him a couple days, so we have like built-in reminders so that they haven't come in for 2 days. A push notification comes up on their phone, and it looks like a picture from the doctor, and it says, "Hey, I miss you. Can you record your information?" The last third are the people that you really have to be concerned about, and they generally, when you as a doctor ask them, "Hey, can you will you sign up for this program?" They'll say, "Yeah, that sounds great," and they kind of sort of never will. They'll never use it. So the questions that you can ask them are, if for our system, are you comfortable with a phone? Do you have, your own smartphone? Do you use it? Do you use apps on it? I'll tell you, one of the most challenging questions, difficulties we have is there's an app like I showed you, and they have to download the app. So for all of you who are blessed or cursed with the Apple, ecosystem, you have to know what your Apple ID and password is, and that actually is one of the number one impediments to people onboarding, is that they just don't know. In fact, one of Christine's patients had to call his brother because it was his brother's phone and he didn't know what the Apple ID password was. It was quite hilarious, and it takes a lot of patience.
Greg,
Yeah.
I'd love to try to help answer that question also.
Yeah, jump in.
So, there's a lot of demonstration here for what would benefit a provider. And I can tell you RPMs have changed my practice approach in many ways. And if any providers are on here, I'd be more than happy to talk to you about how it has impacted the lives of my patients and improved my revenues. However, really key is the monitoring of our elderly. And I can speak on this. Okay, so for instance, you see this watch where I think this monitoring system is not only beneficial for the patient, but it helps families. So you have a daughter in California, and she's, Mom, Dad, I really need to monitor you a little bit better. And you can see even the steps at night when Greg was sleeping all night, but you can see if he gets out of bed and he starts walking. Well, imagine that's your dad, and he gets out of bed how many times a night? 6. And like, Dad, what are you doing? Well, I'm going to the bathroom. I'm like, that's a lot of times, Dad. You need to talk to your doctor about this. So these are the things, something as simple as that, but all this monitoring, I could speak on, the 88-year-old, they may have some difficulty at first. I know I have 1 or 2 patients that did. And it is dependent on the type of system you use, but in general, I think this is the future. And I thank you for letting me just share that one insight about 88-year-olds and how user, let's just say how essential it can be.
Well, Christine, actually, it's a good time to jump in a question I have for you, and that is, how do the 88-year-olds or whatever it is, how do they view it? Like, what's their general reaction to when you say, "Hey, I've got this remote patient system, would you like to be involved?" How do they?
So typically when you're 88, there's a caregiver involved. There's family involved, there are caregivers involved, my patient is in assisted living, a small group home, not the large ones, but the smaller ones. I would say that about 100% of my practice is I'm doing remote patient monitoring, or I could say close to one. It's very, very near, if it's not all. I require it for, I have a system that I require my patients to use, and the caregivers who are so compliant. They're the ones that are compliant and making sure that the blood pressures are taken daily, right before, prior to every medication, especially if it's any medication that affects blood pressures. So if they're CHFers and COPDers, and they need that pulse oximeter. So it is, the compliance comes in very highly, and so it's really the caregiver's role, and they're very good at it. And now that it's COVID, you can't ask for a better time actually for compliance, because nobody wants to share equipment. This is equipment that is theirs. They don't, any nurse or PT that comes to them, like, no, you don't use your equipment on me. I use my own equipment on me. So it's that type of, it's a benefit, and it does help with compliance and helping our older patients, my older patients, stay monitored. And I can't tell you how many times I've gotten readings. I'm like, oh, and I see these readings, and I get phone calls about these. So I hope that answers some of the questions.
Yeah, no, it definitely does. And I think one of the other keys to success in implementing a remote patient monitoring solution is to make sure it fits into your normal workflow. So, if you have to change the way you work dramatically and it takes you more time, I can tell you, you're not going to do it very long, right? The one thing we get from physicians is like, I don't have a lot of spare time. And if you're going to make me do a lot of extra work, I'm just not interested. So we tried to take our solution and take as much of the friction, as we call it, away from the doctor so that they can focus on actually doing what they're good at, which is figuring out how to take care of the patient, not all the mechanical pieces. Yeah, go ahead.
Christine, well, we have a bunch of questions that I want to get to, but as you were talking, Christine, and this ties into what Greg was just saying, you'd mentioned how many of your clients are on this platform?
Pretty much. Oh, well, this particular platform, I'm speaking on RPMs in general.
Okay.
I can't speak on this one in particular.
Oh, okay.
Yes.
But so now how has that, I know it's helped improve your efficiencies in your monitoring of your clients, but has it also helped you financially in terms of your operations and revenue and then how much time does it take for you or your team to onboard somebody to an RPM?
Well, this has been quite a boon for my practice, I will be honest. The RPM onboarding is seamless. And yeah, the reimbursements are very nice because of the compliance that I have in my practice. Again, everybody is pretty feverish about making sure that they are, doing things, they're monitoring daily because of they don't want to go to the hospital. They do want to make sure that everything is checked and all the boxes are checked off. So it is, the reimbursement has been very, very nice. I'll be honest.
Great. Would you guys like me to read a few of the questions that are coming
let's
in?
go for the questions.
Okay, excellent. So let me start at the top here. Ralph says, oh, this is in reaction. You were saying that you were trying to get FDA approval. Ralph Sklar says, do you know if any other similar products have gotten FDA approval already?
Yeah, actually, and there was another question about that in the Q&A. The Apple Watch, for example, has a couple of FDA approvals for the PPG sensor, which is the LED underneath, as well as an ECG. Samsung, Fitbit, which is now Google, and Withings or Withings. I never knew how you pronounce that. So we're certainly not the only ones, and we don't even have ours yet, but we're a little bitter about that because we've been working on that for 2 years. But I would say it's less about the product and it's more about the overall system. And a big piece of the system is your Christine, right? Because it's kind of a window to your doctor or vice versa. And so another one of my critical success factors is that the doctors have to be plugged in so that the patients know there's a value to what they're doing. If you ask someone to do something day in and day out, and it's like a black box, they put it in, never get anything out, they're going to stop, right? But what Christine, I'm guessing when you talk to them, you're aware of their measurements and you know what's going on. So they feel an obligation to kind of keep the box full. Is that kind of the way it goes?
Well, I can be aware of what they're doing by a touch of a button. It's very quick, and then I get reports.
And you get alerts too, right?
Pardon me?
You get alerts too when something's.
I get phone calls actually from, and I get phone calls from a company that reports that something's
Right.
wrong.
So there's certain thresholds. If they're over some level of blood pressure, then you get a phone call and they say your patient XYZ. And how do you feel about that? Does that work well, or is it a pain in the butt?
Oh, no, it works well because it's a further history that I can, document and, absolutely it gets my attention when I get a phone call that there are several parameters that have been exceeded.
So we find that it gives the patients this kind of sense of that somebody's watching, somebody kind of cares, versus I don't really know why I'm doing this. It's much more of a, oh, well, so, someone's kind of making sure I'm okay, which is almost more an emotional thing than a physiological thing. But they also go hand in hand, I feel like. I've gone on a couple of calls with Christine with those 88 years old guys, and it is unbelievable from a technology standpoint guy. I'm like, this is not hard, very easy. And Christine's just so mellow and so patient with them, and obviously that's what they need. And so I guess my point is it's not about the technology at all. It's a tool, but really it's an avenue to the provider. And it's like any tool. If the provider's not doing the right things with the tool, it's not going to work out for you.
Yeah,
Great.
it creates a human component. It doesn't replace, it actually creates more human opportunities for human contact and interaction. Yeah.
Well, and in the case of a physician, we go in and we get a physical, and the physician is just looking at us in that one point in time. This gives the medical practitioner the ability to see what's been going on over the last 6 to 8 months, if it's that case.
Oh
So-
yeah, in fact, this guy, I can jump on this real quick. This guy has been using our system for over a year, so I can change this to like 2019. Go ahead, Christine. I'm just going to show
I
data.
was just saying, it's key for any kind of, any kind of changes to your medications. You can see if it's impacting your biometrics, and that's very important. Yeah.
Okay. Let me get to some more of these questions. We got a lot of them here. Louis Tenenbaum says, what is your reaction to the new Amazon Care Hub intro?
Well, I think Amazon, for those of you not familiar with it, they have a wearable, and I think it's like $9 a month or something like that. And it doesn't have an ECG, but it can monitor your steps and your heart rate and stuff like that. I think they're going to be a player in healthcare at some point in time. I don't think this is it. I think people are wary enough about Amazon, and I can't say the ALXEA word because I have one sitting next to me and it'll like wake up and do stuff. But like we're getting tracked enough as it is. And so I don't think there's a great benefit from doing this. And I think the people who are already interested in doing what they call the quantified selfers are already doing that. I think it's kind of a miss. I don't know if you guys have an opinion on this.
Okay. Let's see. Galera says, who can have access to this information? What is the level of security for the information?
So obviously the big question is about HIPAA security. Can the right people see it? Is it accurate? And obviously we run on a secure platform. As you can see over here, it's HTTPS encrypted. So, we follow the normal IT stuff. I came from, a DoD background, so I know all that stuff. But more importantly, who has access to it? We can opt doctors in and out on the patient's behalf. Obviously, HIPAA is actually, the P is not privacy, it's portability in HIPAA. It's more about sharing the information. So we can connect or disconnect doctors to the patient's record at any time. We feel that the data is the patient's data for them to do what they want. And especially with transitional care, I think it can be very valuable for a doctor sometimes to check in and check out. Sometimes it makes sense for them to look, and sometimes honestly they're gone and they don't need to be part of the patient's world anymore. So it's pretty granular. I would say there's one other group that we don't really talk about much, and that's Christine touched on this, but from a professional standpoint, and that is caregivers. But what I mean is family caregivers, people who are brothers, sisters, aunts, uncles, daughters, whatever it is, who will take care of their mom or dad. And they are great because they provide technical support. They obviously want to help. And they don't have a lot of information to go on. They don't know if their mom's healthy. They don't know if their high blood pressure is a problem this week. But we can take these alerts and send them to the physician. We can also send them to the patient, and we can also send them to, I don't know, anyone with a cell phone. So if you want, we could send daily, weekly, monthly reports to family members, obviously at the patient's approval. So
Okay.
if they want to share this information with people who are part of the ecosystem but not traditionally thought of that, we can do that too.
Great. And Amal has his hand raised, so I'm going to click on the prompt to allow him to talk. But while you're coming on, Amal, let me get you a question from Ravi. And Ravi asks, are you connected to electronic medical records, or is that separate, the electronic wellness record?
So we actually start with, when we create a new patient, we actually download the continuity of care document, the CCD, from the EMR, and that's our integration. We don't want to get our hands directly into the EMR because that's all kinds of messy, but we also don't want to make people duplicate information. So for example, if I started with, I had a preloaded CCD, which was exported from an EMR, EHR, then I can just use that as the input, and it'll create a patient, and it'll pull in some of the data from that EHR. So that's how we do the integration.
Great. Amal, can you hear us? And
yeah, I can
do you
hear you.
have-
Can you hear me?
Oh, okay. And Amal, you sound like a female. I apologize for.
Oh, that's okay.
Okay.
My question was, I mean, this device is for elderly. I was wondering if the doctors will recommend to the patients, as well as if Medicare is going to be paying for it because it's for saving lives. I don't know if that's an option.
So Christine, I'll let you take the first part of the question.
What was the first part is again, Amal?
If the doctors are recommending to the patients to have this device, are they talking about it?
Well, I can only speak for myself, and I semi require it for my patients. My RPM program that I participate in. So because of the extra layer of monitoring that I think is necessary for my patients, especially during this time when they're so homebound, and my particular patients are homebound to begin with, and then of course during COVID.
Thank you.
So your other question is it going to be paid for by CMS? So I can get into more details on that. Probably better if you send me an email and I'll give you a primer on that because it'll take a long time.
Okay.
But basically the answer is yes.
Thank you.
Great. Thanks, Amal. And let's see, we've got Taish Natali. What happens after hours? Do you get phone calls after hours regarding the patients, and how do you handle them?
Is this for me?
Sure. Well, because you said you got phone calls. Our system only sends emails and it can send text messages. We don't really believe in calling people at all hours. So I'll let you answer that one.
Oh, I occasionally get calls. I had a call this morning. They leave messages. If I don't necessarily have to pick up, I can look at the message or listen to the message. I would say if they're taking their blood pressure at 3 a.m. and it's out of range, or very out of range, I'll probably get a phone call. But I've never had anything like that.
Do you have it set up so like, I guess there's certain key alerts that you could set this up for, so that if like blood pressure dipped below a certain level or above a certain level, that the provider would be notified, or is that?
Well, for instance, in my case, in the case that I'm experiencing, I set parameters for all my patients for their blood pressures and heart rates, and then it will show up as out of range. And if it's particularly in a critical out of range, then you can start getting phone calls.
Yeah, and I guess going back to Amal's question, is are physicians recommending this? I guess sort of the first step is a medical practice embracing RPM in their practice, and that's one of the reasons why we're doing this presentation today, is because for those of you who are working with physician and medical practices, uh, just asking, are you on an RPM system? And if the answer is no, asking them why, and you could connect them with Greg, and they could at least explore it. Then once you make that commitment, I guess it's the practice's commitment to letting all the patients know that this is available. In addition, an RPM system could be used not just a physician's practice, it could be a home care practice, correct?
Absolutely.
So if you wanted it to be connected to a doctor, then it needs to be prescribed in order to get the reimbursements. But there are some cases where we've provided our solution to the self-insured or the uninsured. So they'll just buy the platform and they'll do it because they really want to.
And
Okay,
let me
great.
speak, if you don't mind me speaking as a testimonial, now particularly for the watch that Greg has right now, I was wearing it. I wanted to test it before. Of course, I would have my patients wear it. So in testing it, it came up with an abnormal rhythm consistently. So I'm just going to be honest about it. It did drive me into the my PCP and my cardiologist for a full workup. I'm fine. But there is, it is something that I think is invaluable for driving people to go to the next level of care. They need it.
Great. Someone asks, what about body temperature? Should temperature and can temperature be monitored?
So temperature can be monitored. We have a whole host of things that are just self-entered. We haven't connected to a Bluetooth thermometer just because we feel like most people have thermometers already. And the same thing is true with blood sugar, blood glucose. We haven't done a Bluetooth integration, but we feel like most people have their favorite blood pressure, blood sugar monitor already. And they've made an investments in how they work and the strips and all that stuff. So basically the only difference is you would use the app and you would type in a 2 or 3 digit number for blood sugar, or there's also a scale that we have integrated, but for temperature, yeah, you could just type it in. And that's something that some people, it really depends on the patient and what they need to have monitored.
Great. And Vicky Stern asks, can you give access to the data to the patient's other doctors? I'm assuming that that's obviously with permission.
Yeah. So we have to sign an agreement with them so that they know, we have to do a business area agreement with them so that we know that they are confidential with the data and all that stuff. But technically, yeah, we add a facility for them and then we link people to their facility, and you can be linked to multiple facilities. So it works really for, someone who has a primary care physician that goes to a specialist and comes back and goes to a different specialist. unfortunately, it's not a great thing for the patient, but if you're in that position, at least you'd like the benefit of the data kind of to be shared with everyone. And absolutely, technically it's a piece of cake.
Audra asks, does this platform work on Android? as well.
It does actually, and because we are somewhat one of our mantras is that you cannot tell a patient what to do. I don't know. The doctors probably have a better idea of that than we do, but that's kind of the mobile device mantra too. Is like, I don't know if you remember, but one of the most exciting things that I think it was iOS 4 came out with was, does anyone remember? It was the fact that you could change your wallpaper on your screen so that it wasn't one of the prefab ones. And if you wanted to make your grandkids or your cat or your dog or whatever, you could. So what does that teach you? And that is, when people get to do things their own way, they're happy. So yeah, we have almost an identical version that runs on Android as well. Obviously, most of the world doesn't use iOS either. So we've got some people using our system in Japan and China and India. So anywhere it's not the US, generally a lot of Android. So definitely yes.
Ada Horsfall asks, are there certain parameters that must be met prior to being prescribed the device by a primary care physician?
There are some. I mean, obviously, if you're completely healthy, 25-year-old, I think Medicare is not going to be super happy that you prescribe this to them. But it's mostly, do they have any chronic conditions that would be benefited by having this monitoring? And then you would select the right set of tools, whether it's a pulse oximeter, blood pressure cuff, the watch or scale. For our system, we always start with the watch because that is the everbeat watch. And then we add in whatever else you need. But yeah, it does, there almost anyone could benefit, but the question is Medicare going to find financial rewards by prescribing this to people? And that's pretty much only people who have a chronic condition of some sort. If you're fully healthy, it doesn't really make sense.
Ralph Sklar has a good question. What are the costs for the watch in the ongoing system?
So,
and then I just wanted to confirm the watch tells time, correct? It doesn't.
Yeah, it does actually. It's funny, because we always, I don't know if you can see it, but there's the time. Yep. It does a lot of things actually that are kind of inconsequential, but it makes people happy. It does the sleep steps. It does a goal. It lets you know when you have a text message or a phone call, which is nice because your phone might be in your pocket and you can just look at it and go, oh, it's my son or my daughter, or it's not, and I don't care. So, but the overall cost of the system for people who are paying out of pocket is $300 for the year. But obviously, if you get it prescribed, then it's free for you with one caveat, and that is obviously with Medicare, Medicaid, there's a 20% copay unless you have supplemental, in which case that's usually covered. But so if you wanted to buy it off the shelf, the entire system is about $300 for a year's worth of service.
Okay. And then Audra, I think I know the answer to this, but Audra asked, can you share the link with the physician to see the data and the physician? She was questioning the physician's portal. That's what you've been showing us here, the way that you have been able to sort of show us on the screen the list of the different people and their healthcare data. So this is what a provider or a physician would see.
Right. Okay. That's right. So this is a little noisy because obviously we're doing some testing and this is our own people. I mean, for HIPAA reasons, I couldn't show you real patients, right?
Yeah.
But these are our own patients, so they've given away their HIPAA rights.
Great. And then a question back from earlier from Louis Tenenbaum relates to when we were talking about Alexa. It's the interface with Alexa is critical. No, so I think what he was referring to is potentially interfacing this with your platform with the voice technology.
So we actually haven't gotten there yet. I guess there's kind of a question of how many, of the seniors, I mean, Christine, how many people do you think of your patients have, an Alexa type device? Yeah, not that many. I think it'd be really cool because like one of our actually my favorite features is a medication reminder. So, you know, when you get older, unfortunately, you might have 4, 5, 6, 7 different medications that you take on different schedules and you don't remember. And so having reminders, that's easy for a computer to do basically. You know, this one's every third day, this one's every second day, this is twice a day. That's easy for a computer to do. But then what we can do is we can track it. And so we can tell you, let's see, this is my CEO. He actually has AFib, which he found out through the watch as well. And so these are his medications that he takes. He's been traveling, so he's been missing some of them. Um, but anyway, to the Alexa question is, I thought it would be kind of cool if you can just talk to your Alexa and Alexa says, hey, you know, did you take your medication? And you can say, yes, I did. It'd be a lot easier for people than looking at the phone and clicking on some stuff or whatever. But we're not there yet. It's a great idea. I as a technology guy, I totally want to get there. But like Christine said, I don't know the penetration of our cohort of users is that high yet, but we'll get there.
Great. And then that, and just to let everybody know, we're winding down here. It's 5 minutes to 1, but we got a few more questions here, but get your questions in here. But that kind of ties into Kathleen Morris's question. Does RPM, remote patient monitoring, make health recommendations to the user? Drink water, take more steps, what have you? And that's what we were speaking to.
Yeah, so right now it doesn't do anything automated, but obviously that's part of the vision. What we can do is that for each patient, you can have a care plan. This care plan for this patient is to eat more Hawaiian pizza. But you know, maybe you would want to have something more practical. So if I created a new one, there's a spot on the device that shows you what your care plan is. And what'll happen is it would push the care plan and you get a push notification that says, hey, you have a new care plan. So for example, Christine might say, you know, hey, I've noticed that your blood pressure is going up a little bit this month. Don't forget to take your medication or something like that. We have to be careful in having things are automated because there's all kinds of liabilities associated with that. But I think eventually we will get there. And but for the time being, it's a mechanism for the doctors, the physicians, you know, the PAs to kind of reach out without having it to be synchronous, which I think is effective. And plus, people don't remember, right? They're like, now what was that? What did she say again? You know, they could go back to the care plan, it would be there.
Really good question here from an anonymous attendee. How do you find physician or care provider who will provide remote patient monitoring healthcare services to yourself or your family members? And they mentioned, thank you for this interesting and much needed healthcare service. Is there sort of a database or directory of physicians that are using RPM?
So I can only speak to my, you know, practice of you know, for everbeat, but I would say it is expanding. You can ask them, and if their answer is no, then you can connect them with a vendor like myself, or you can, you know, recommend like, hey, I saw this great demo, maybe you should check them out. I mean, and it is relatively compelling for the physician, as Christine said, you know, there are significant financial rewards, and it's for the process of doing, you know, I think a better job for your patients and hopefully, you know, creating better outcomes. So it's not like you're ripping CMS off at all. I think, you know, you're doing a really valuable service. So I think for a lot of physicians are not really aware that it's out there or are afraid of having more work. So I think if your physician, again, I don't think we can get anyone to change, but if your physician or your, you know, the people involved don't have a remote patient monitoring, then you can say, hey, why don't you contact this person, or is it okay if I have this person contact you?
Yeah, and Amal Farah, I'll make this the closing question, but it's a really good one, is like, as a caregiver, can I implement this device in our care plan? Oh, okay, so for the client, she's saying, can I implement this device as to our care plan for our client? Like, you could do this with one client, correct?
Yeah, you could definitely do it with one client. The only gotcha is that it's in order to get reimbursed, you have to be able to bill Medicare directly. We don't do that. We
Yeah.
provide a platform for the physicians, for the PAs, to help them provide a service, and then it's up to them to do the billing. So if you can bill Medicare, then yes, you can prescribe a remote patient monitoring solution, and then everything kind of starts from there.
But in theory, let's take Medicare and that reimbursement out of it at $300 a client. Like a home care provider could say, hey, this is something that we're providing to all of our clients.
Yeah,
And
that's true too. Absolutely. And in fact, we think that there's some, like Christine was saying, that the caregivers, some of those groups may benefit by having the system so that it kind of automates their work. I don't know, Christine, do you have a thought?
Sorry, I'm a little glare here. Yes, I mean, I think that this is probably better suitable or better suited with facilities that they could monitor and offer this as part of
oh,
their,
like an assisted living community.
yes,
Yeah.
part of their suite of monitoring systems that they can, and then, it's a portal system, isn't it? For families that can check in and say, hey, how's mom doing? From, again,
Yeah, I mean, we can set
California.
up a facility for the family as well, and then you can have brother, sister, uncle, whatever, all look at, your dad's information or whatever. Yeah.
Yeah.
And I lied. I'm going to give one more question because Lori Pross is a friend of mine. And she asks, what about a patient that has dementia? I actually think this would be an amazing option for somebody that has memory or cognitive impairment, because now you're not confusing them with the more hands-on monitoring. You're monitoring them over time.
Yeah, Christine, you've had some situations like that, haven't you?
Well, for dementia patients, I mean, again, this is what's good for when caregivers are involved with making sure that the blood pressure is done, or the watch is being, maybe the ECG is done, what have you. So as long as that the caregivers involved with that program, caregivers are already taking blood pressures. They're just using this cuff, or they're already doing many of these things. They're just using this device instead.
Great. Man, what an informative and great session we had today. Thank you, both Greg and Christine, for your time. And for the audience, I will share the recording. We're also going to upload this to a podcast so you could share it with your friends and they could listen to it while they walk their dog. And I'll make sure to follow up with the contact info for Greg and Christine if you wanted to reach out to them. However, Christine is all over the place, so
just never too busy to answer questions. Absolutely.
Yeah, no. So this is great. Thank you to you all and to the audience, and I wish everybody happy Thanksgiving, and stay safe for this one so that we can have a great holiday season.
Yeah, and also just one last thing, that there is a survey that we are asking people if they're more interested in following up. And if you fill it out, we will send you 10 of those masks that Steve was talking about.
Yeah, that's great. I'll make sure to resend that link to everybody. Thanks, Greg. Thanks, Christine.
Thanks for the great questions. I loved it.
All righty.
Happy Thanksgiving.
Bye.